everyone, it's me, Dr. Whimsy, and today we're covering a topic that I get asked about a lot because I deal with a lot of digestion challenges in my office, and that is the subject of constipation. People who suffer from constipation for a variety of reasons. If you think that that is your challenge, then that is what we're going to be looking at today, and hopefully this video will be helpful to you. When someone comes into my office for a condition like constipation, and that is the main problem or challenge that they're having, like everybody who comes into my office, I'm going to make a thorough assessment to try and figure out what the cause is. And there are a lot of causes for why something that's a relatively common condition like constipation can happen. So when you're taking that assessment, the first thing your doctor is going to ask you is, when did that problem first start? So sometimes it can be a change in medications. If you noticed a correlation between a new medication that your doctor may have you on and the problem starting at the time you took that medication, then it could be that the constipation is due to some kind of an adverse reaction to your medication. So you want to rule out that there isn't something like a medication that's causing the problem. If there's been a change in your exercise program, that can also aggravate constipation. The reason being that when we exercise, when we physically move, we actually help the process of peristalsis. Peristalsis refers to those wave-like movements that happen in our digestive system that allow us to digest our food and for the bolus to move through the digestive tract, from the stomach to the digestive tract, and then eventually waste matter will make its way to the large intestine, colon, and then we can eliminate it. That whole process requires wave-like movements that we call peristalsis. So when we exercise, we actually help the process of peristalsis. That's why when you take your dog for a walk, the dog is able to move, get his bowel stimulated, and go to the bathroom. So simply by increasing exercise, we can sometimes have a more regular bowel movement. In terms of the class of medications that can sometimes cause constipation, the opioid medications are really at the top of the list. And those are medications that we usually prescribe for chronic pain, or people who come out of a surgery or in receiving hospital care. They'll come out of the surgery, and then as a consequence of being on that class of medication, they sometimes will become constipated and have trouble having a bowel movement. Also, people who are suffering from drug addiction to opioids often have constipation as a side effect. Other classes of medication that can cause that are the diuretics, the antihistamines. Anything that dries you out can also cause a dry stool, and that can lead to constipation. So again, if you see there's a and there are many others, but those are just a couple of examples. If you see there's a correlation between the constipation and a change in your medication, be sure and talk to your doctor to possibly change up the medication or stagger the way you're taking the medication in case there's a correlation. If it's a correlation between you changing up or not exercising as much, getting out and moving can also help as well. Sometimes it has to do with something as simple as diet, changing up your diet. If you're not having 7 to 9 servings of fruits and vegetables a day, then you can suffer from constipation. Certainly people who eat meat are going to be having probably less bowel movements on average than people who are on a whole food plant-based diet. And that's because people on a whole food plant-based diet are eating foods that have a much shorter transit time. Plant foods tend to go in and out of the digestive tract very, very quickly. They're also high in fiber, and fiber will bulk up the stool. And in addition to bulking up the stool, fiber can also work to be what's called a stool softener. And so the stool is bulked up, the stool is softened, and the transit time is shorter. So it's not unusual when I'm treating somebody who is on a plant-based diet that they'll have 2-3 bowel movements a day versus a meat eater that might only have one a day or one every other day. So one of the fastest ways to help a person who is suffering from constipation is you want to talk about diet. You want to make sure they're on a diet that is going to allow for natural transit time, so that you're having regular bowel movements. Ideally every morning, up to 3 times a day. 1 to 3 bowel movements a day is usually what we would call the normal range. If it gets to be 5 bowel movements a day or more, at that point we start looking at the condition of diarrhea. But if you're right in that ballpark of 1 to 3 bowel movements a day, then that's ideal. That's what we're seeing as ideal. There are some medical conditions that we also want to rule out in people that suffer from constipation. For example, if you're suffering from hypothyroidism, constipation can sometimes be a side effect of hypothyroidism. Then if you had a past history of hypothyroidism, weren't having a problem, had again a medication that was working fine and now doesn't seem to be working, and you're starting to have a side effect of constipation, might be a good idea to go back to your doctor, have your thyroid levels tested to make sure that you are in fact on the right dose of thyroid medication. Another class of or another group of people who we sometimes, 2 other groups I want to mention where we see constipation, is hormone changes during a woman's normal menstrual cycle, and the last is the process of aging. So regarding women who are going through hormonal changes, that's something that we see that's very, very natural, where we'll see alternating. It's not unusual or what I would even call necessarily pathological to see changes in bowel movement habits at different times in a woman's cycle. Sometimes having more frequent bowel movements right before your menstrual cycle, and alternately some women will complain about constipation, bloating, holding on to water right before their menstrual cycle. And finally, the last group of people I want to talk about is people who are getting older, 40, 50 years old and above. We sometimes see an increase in constipation because maybe you're not as physically active as you used to be, so you want to talk about increasing exercise. But also that natural peristalsis that I had mentioned before, that natural movement of your digestive tract, that natural peristalsis activity can decline as we age. And that is because peristalsis happens because smooth muscles in the digestive tract are doing their thing. And like all of our muscles as we get older, they may be experiencing, we may be losing some muscle mass, and we need to take that into consideration. This is why people who get older will sometimes start trying to find ways to increase their fiber consumption, eating, the old, joke about eating prunes or whatnot. But really, it's anything that's high in fiber. I personally wouldn't pick prunes because they're, if you eat too many of those, they have a high sugar content, and that might not necessarily be the best thing. In terms of how to treat, I think that how I usually treat a condition like constipation is by looking at the individual. I have to be very careful in my pregnant patients, which was a population I didn't address in this video, just because if you're pregnant and you're having these types of challenges, you have to be careful with some of the herbs, because some of the herbs that are prescribed for constipation are contraindicated in pregnancy. I'm not a big fan of senna and senna tea. A lot of people do senna, which is a laxative. They'll drink some senna tea before they go to bed at night, and then they'll wake up in the morning and they'll have a bowel movement. There are a number of reasons why I'm not a fan of senna. Number one, it can become chronic, where some of my patients will take senna tea every night, and they're doing that in lieu of treating the underlying cause for the constipation. I had a patient a few years ago when I was in medical school, my final year of med school, who was chronically using Senna. She was very underweight, and when we did an intake, we found out that she was not eating enough calories. Yes, she said she ate fruits and vegetables. She ate these foods, but when we did an intake, we realized that she ate very little food in general. And so just talking to her about increasing the amount of food she was consuming allowed her to have a bowel movement every day. But because she was challenged with she had eating disorder challenges, she was not eating. And so she was not having a regular bowel movement. And then in her mind, she thought, well, I'll just take Senna tea every night. So the underlying problem was not the constipation. The underlying problem was an eating disorder and a dependency on laxatives. So we always want to understand the bigger picture. And that's a good example of that. I like some of what I'm seeing in terms of results of people who try doing magnesium powder before bed. I don't think there's anything wrong with adding that because magnesium is calming. It helps you sleep at night. Up to 200 milligrams of magnesium dose, I think, is safe in pregnancy. I think that's the official recommendation we give. If you take it at night before bed, mix it in a little water and drink it. In the morning, it can help have a laxative effect. In the morning, in people who want to add additional fiber, I sometimes recommend ground flax seeds, and that's one of the main fiber sources that's my go-to choice because it's high in omega-3s. And so in addition to the ground flax giving you a little bit of support as a bulking stool, to bulk up the stool, soften the stool, a great source of fiber, it's also giving you those omega-3s. So 2 heaping tablespoons of flax every morning in a glass of water with a little bit of lime or a little bit of lemon. If you don't like flax, you can try chia. That also works great. 2 heaping tablespoons of chia, let it soak for a few minutes, squeeze in a little lemon or lime and drink it. Usually that works great. Some people who also have alternating stomach upset in addition to constipation, for example, if you have a history of burning in the digestive system, too much heat, too much fire, acid reflux, some people have benefited from taking whole aloe leaf, pouring a little bit in a glass, about 1/4 cup to 1/2 cup of spring water, and drinking that every morning, and find that is helpful throughout the day. All right, those are some basic ideas I have for you. If you do feel like you have this challenge and you feel like it's a little bit more serious than anything I covered, then absolutely go back to your doctor. Make that appointment and go have a checkup. Sometimes constipation can be a sign of something a little bit more serious than what was covered today. I encourage people, if simple remedies are not working, to go back to your doctor and have that conversation. To find out more about naturopathic doctors and to find one in your area, one who's gone to medical school and is trained to practice naturopathic medicine, you can go to the American Association of Naturopathic Physicians. I'll leave a link to their information below. If you're in the Los Angeles area and you're looking for a naturopath, I'll leave my information below. And I'm also available for general wellness coaching via telemedicine. I want to thank you for listening to this video, giving some basic advice on a subject that unfortunately too many people are challenged with, and hopefully this gave you a little bit of help. So thanks for watching, take care, and we'll see you next time.